CareEpilepsy, a non-profit organization that aims to achieve a better quality of life for people affected by epilepsy, works tirelessly to improve health situations and the overall quality of life for people suffering from this disorder in Africa. This film illustrates the horrific stories of people living with epilepsy in Ethiopia. Fatima Zemu. I like myself, but people don't like me. I like the people who like me. No one wants to touch or kiss me, not even my family, says 22-year-old Fatima Zemu. Zemu was full of life when she spoke and craved friendship. Fatima fell into an open fire due to an epileptic seizure. The flame had already burned her face, neck, chest, most of her body. Consequently, her skin shrank to close the wounds, creating what is known as burn scar contractures, and she was subjected to a skin graft. This is one of the multiple post-burn scars that Fatima carries with her. Such encounters with members of society have forced Fatima to believe that she must be cursed and have some sort of evil spirit within her. As a result, she does not want to get married for fear of passing epilepsy on to her children, or suffering a seizure during her pregnancy which would hurt the baby. Fatima wishes to be able to work and support herself and spend time with other people who live with epilepsy to share her problems. Kadino Kofto. This is a punishment from God, says 30-year-old Kadina Kofto, while referring to her epilepsy case. She lived with it without any medication for 20 years. She fell into the fire, which burned 7.5% of her leg, forearm and hands. I want to get married and start a family, but I am convinced that no man will marry me, says Kadima with watery eyes. As a result of such self-deprecating views, she often suffers from depression and self-hate. She likes the darkness. I feel safe, hidden away from other people, she sadly states. When asked what she wishes for, she responded, I want to work and support myself and spend time with other people who are just like me. Fozima Teman. She does not know what epilepsy is, but does not believe that God cursed her with this disease. Fozia has generalized tonic-clonic seizure and is on anti-epileptic medication. She continues to have seizures, but much less often than before. Fozia was admitted to hospital when she sustained a burn accident involving her leg, forearm and hand when she lost consciousness while cooking over an open fire. Please tell me what epilepsy is about and why I don't remember when I get sick, was her question. She wants to get married, but is convinced that no man will marry her. She likes working at the mission compound and helping others. I want to meet people who are suffering like me. I want to know how others feel about their epilepsy. Aisha is a 40-year-old woman who believes that she is possessed by some sort of evil spirit and had never attended a clinic for epileptic treatments before suffering a burn injury. Aisha lost her daughter from a seizure-related burn. Bandi. Bandi was not able to talk much as her mouth was sore. You could hardly hear her voice. When I asked her about her epilepsy, she responded, I have no idea what epilepsy is about, but I know I am cursed. She has never received any medication, even though she has been suffering from generalized tonic-clonic seizure for the past 16 years. Bandi sustained a burn accident involving her ear, face, neck, arm and hand when she lost consciousness while baking injera over an open fire. Now she suffers from fever and wounds that appear warm, red and painful. Her infection was characterized by abscess formation, foul-smelling pus and tissue destruction. Her life is at a crossroads. If she does not die of sepsis, she will have to have her hand amputated. When asked if her family came to visit her, she responded, I have no one to come to visit, and I eat the leftovers from the other patients. I am glad I share a room with 9 other patients. A heart of numbness and pain can be seen through her eyes, and it has been hidden there for quite some time. Patient X. Her father did not want her name mentioned. Patient X was unconscious, sleeping on one of the beds at Jimma General Hospital. Her story was conveyed by her frustrated father. He was not sure of her age, but he thinks she is approximately 19 years old. She gave birth to a baby girl a month ago as a result of a rape. She is lying here due to a burn accident involving her ear, face, neck, arm and hand when she lost consciousness while cooking over an open fire. Zainaba Mohammed. 16-year-old Zainaba lives at the Catholic mission in Jimma. She started having seizures at the age of 3. I know before a seizure that the devil pushes me to fall. Zainaba describes this aura, a sensation where one knows just before the seizure is going to occur. Zainaba gave birth to a baby girl 2 months ago. Her fiancé left her after witnessing a seizure while she was pregnant. Kidis Teresa. Her father left her at the mission door with a note stating, "This girl is possessed by the evil spirit, and we are not able to care for her anymore. No one knows where she is from." They did not know her name, so the mission gave her the name Kidis Teresa, named after Mother Teresa. Life is a challenge for Kidist. She lives with autism and epilepsy. Kidist has no access to medication and has never been seen in a hospital for her condition. Bethlehem Teresa. A beautiful girl with a smile that lit up the room. Just like the others, she was left by the mission door and named Bethlehem Teresa. Bethlehem has cerebral palsy and is not able to sit on her own because of poor balance and lack of coordination. She also has epilepsy and suffers from an intellectual disability. Her condition causes her to drool because she has poor control of muscles of her throat, mouth and tongue. She does not receive any anti-epileptic drug to control her seizures, but faces the seizures with bravery when they occur. Sarah Teresa. An untraceable family is Sarah's background. She has epilepsy and autism and is not on any medication. She was left at the mission door at the age of 5. At least 5 times a day, the nurse said, when talking about the frequency of her seizures. She experiences many injuries when she falls down as a result of these frequent seizures. Aster Teresa. Aster has spastic quadriplegia, the most severe form of cerebral palsy, with severe intellectual disability and deformities of her spine. She has severe stiffness in her limbs and a floppy neck. She is unable to walk or speak. Her seizures are frequent and she gets very tired afterwards. Aster is among the children who were left at the mission door with no family story to tell. She has not received any treatment for her medication. Ashaber Makuria. Ashaber has been diagnosed with epilepsy for 10 years now. He is on medication but has not achieved seizure control. He has seizures at least 3 times a week, and he also suffers from mental retardation. Menit tribe. Patients from these tribes have epilepsy but are not on any anti-epileptic medication. They were found begging for food by St. Michael Church in Mizan Aman town in Benchi Maji zone, about 561 kilometers from Addis Ababa. The community believe epilepsy to be an evil spirit and contagious, trying to enter other concerned families. Stigma and exclusion are common features of epilepsy in this community and a major contributor to the burden associated with the condition. Stigma here is based on 2 myths, that epilepsy is contagious and that it is caused by demonic possession. Belief about possession crosses societal boundaries. In most cases, it is not related to any level of education or literacy. Sometimes it is the most educated people who will tell you that it's demonic.